I don't remember a time when I didn't want to be a doctor, and I suspect that that was because my mother put it into my mind. She was the twin of a man who was a very successful GP in Liverpool, very highly respected, and he was married to another GP, and together they ran a practice in which they were the senior partners with two junior partners, another man and a woman. So I suspect that's where my desire to be a doctor came from. I don't remember having doubted that that was what I would be, although I do recall on one occasion wondering if there were other professions I might pursue and rejecting them out of hand. So becoming a doctor was never anything other than was what I was going to be. It wasn't, I think, a conscious decision I ever made myself. But deciding to be a clinical pharmacologist, of course, was something different. I graduated from medical school in Glasgow, where I grew up, in 1970, having gone to the school in 64. It was a 6-year course. And in those days, you graduated, you did 1 year of what would nowadays be called foundation medicine. In those days was called pre-registration year, or house jobs. And you would then either go into general practice, or you would follow a hospital career, and your hospital career would take the form of either following general medicine, general surgery, or some laboratory specialty. I decided that I wanted to do general hospital medicine in some form or another, but you didn't at that stage decide on a specialty. You did your senior house officer jobs, SHO, you did your registrar jobs, the next step up after getting your basic postgraduate qualification, which in my case was the membership of the Royal College of Physicians. And then you would become usually a senior registrar in some specialty. That would be the time you'd choose your specialty, really quite late on. Nowadays, the young doctors are expected to choose their specialty very early on. But I was unusual at that time because I decided to be a clinical pharmacologist almost as soon as I qualified, in fact. And it happened because a neighbour of ours, who was a radiologist at the Western Infirmary, his name was Jake Davidson, a lovely man, saw me as I was coming home one day. We were neighbours, he lived across the road, and he was doing his garden as I came home, and he came across to congratulate me on my recent results in the final exams. "What are you going to do?" he said. Well, I didn't know what course I was going to follow, but he said to me, "What was your best subject?" I said, well, that was what we called materia medica. Materia medica was an old Scottish name for what we now call clinical pharmacology.